big.
1, 2, 3, 4, 5, season 6. We're rolling on the road. Oh yes, we're rolling on the road. We're 100 shades of invertibility. We're rolling on the road. Oh yes, we're rolling on the road. Ooh, ooh, we're rolling on the road. With 100 shades of the invertibility, we're rolling on the road. Check it away, Cousin Kim.
I love it.
Well, good afternoon and thank you.
Good afternoon.
So I just love Cousin Pat. Well, it's good morning, good afternoon, good evening, wherever you may be watching this broadcast, or whatever time you might be watching the broadcast. So I have to remember that the people watch at all times of the day and all times of the night. So we want to say thank you for whatever time you watch it for actually tuning in. You know, I'm about to get real serious now. I'm about to put my glasses up. Put my glasses up. Put my glasses up. And I'm going to say this. The doctor, they got this saying that says, physician, heal thyself.
Mm-hmm.
So might not be a D doctor. I'm a PhD doctor. So that means that I'm gonna have to rely on the Lord to, go through my healing. On yesterday, I want to say thank you to mother, friend, supervisor. She is okay, getting emotional. I had Supervisor Eunice Feltis Little on yesterday, and we talked about her dissertation that she wrote earlier this year, and she got another doctoral degree. It was educational degree, and it talked about the resiliency of women in ministry in comparison to men. And as she was going through, and some of the things that she mentioned, and I said, it would have been wonderful. Why didn't you reach out to me? Because that part really is in my wheelhouse, with disability. And the next thing I know, I got up on my little soapbox and I was crying the whole show. I was crying. When you have unresolved, unhealed, issues, they have a way of coming out at the least time that you expect them. And for 13 years, I have been going through this whole piece of how the church responds to this. And that's not bad English. It's DIS, short for disability. And it has been less than, I don't know, is there a letter lower than E when it comes on a grading scale, as far as it being accessible and, participation wise. I will say, and I did mention that the church where I did have my stroke, the pastor was amazing and how he treated me as a person. And I want to give a shout out to, Bishop Robert Dean. Yes, because he said, find myself in the Bible. That was how I was going to get through this, by finding myself in the Bible. And I did. And I tell you, if I had not done that, had he not given that advice, this would be a lot more difficult than what it has been. But, my issue has been more so with the accessibility with facilities and even in programming, it being more inclusive. And so I was bleeding on yesterday. I was bleeding. And I appreciate Supervisor for the way that she stopped the bleeding. She cauterized me.
Mhm.
She cauterized me on yesterday, during the show and after the show. And I tell you, today, I mean, I love the advice that she gave me. She just said, at the end of the day, this is your lived experience, and you have more than enough experience, more than enough education that you don't have to wait for somebody else to include you in their story. You can write the story yourself. You know,
Mhm.
you can write the paper, you can write the dissertation, you can write the book, and you have more than enough platform to do it, and you've done it and done it well. And so I thank her for saying that, because sometimes we get caught in these little pockets and we forget what our power is. We have
Mhm.
that one space where someone tells you no, or they don't step up to help meet the need, which, for me, is what's happened in these last few years. Is the opportunity was there for the need to be met and to be on the cutting edge of saying, hey, we have stepped up as a religious organization to make this truly, accessible for those persons, with disabilities, and it did not happen. And I'm glad that it came out on yesterday. So now I'm in the healing process. It's like, okay, good. You know what? We cleaned out that puncture wound on yesterday, and it is healing well. Actually, it's healing very quickly. And I am excited to have you on today because you are an example for me of saying, hey, look, nobody else has to do it. You just get up and you do it. If you don't see it being done, you just do it. So I want to say thank you to you, because as I was putting this together and I did bios, so when people see the live stream or they watch it on YouTube, they will have your bio that you are the creator of Menopause and Mimosas.
Mhm.
And I just, my eyes is too swollen from yesterday. And I'm just saying, Lord, thank you. Thank you, thank you, thank you. Thank you to my guest today. We're here to kind of do a recap,
Mhm.
but I definitely just had to say that, you know what? When you bleed in front of the people, you got to come back and show how you got healed. Is that not correct?
Absolutely. Absolutely. Yes.
As I was typing it in, yesterday, I forgot to hit send and all that other kind of stuff. But I needed that extra time to go back and read what
Mhm.
I wrote. And I was like, wow, she
Mhm.
she stopped that bleed. She cauterized that bleeding. She cleaned out that wound on yesterday. And then to have you today is the covering that I need until it heals all the way up. So thank you.
Mhm.
Thank you, thank you, thank you. This is how we all need each other. And this is why it's important for each person to be in their purpose. If you had not been in your perfect purpose, I would still be like, okay, in intensive care.
Mhm.
So thank you for being in your perfect purpose.
Mhm.
Now, girl, tell us what happened when
Mhm.
the people came on last Sunday. What was it like?
It was phenomenal. The women were very receptive,
Mhm.
engaged. They were engaged in the conversation. As our storyteller, Dr. Sh- not Dr. Satori Shakur, she has the
Mhm.
storytelling business, the Secret Society of Twisted Storytellers. She did her intro and she gave excerpts from her film. Her film is on YouTube and some other platforms, The Confessions of a Menopausal Femme Fatale. And as she was telling her story, the women connected with her experience and shared, I went through that, I feel that way. And the women just opened up, their hearts just opened up. They're such willing vessels to share what they needed help with. And I was so glad. I said, oh, thank you, Lord. Thank you, Lord. Today is the day that we needed to hear this. So each person told why they were there. They introduced themselves and were able to address their needs. So it was good. It was really good. I was really excited. Also,
what were your 3 takeaways from it?
my 3 takeaways: that we have more women who need this information. That was my number 1 takeaway. Hello, can you hear me? We have Black women everywhere. We have women everywhere. We have men who need this information. So we need to get into more communities, to have these one-on-one, these group meetings, so that we can have these conversations, so that we can have workshops, so that we can give this experience to people who are hungry for the information. That was my biggest takeaway. The second takeaway was talk to more people. Share this information wherever I go, with whomever I see. The other day I was in a bakery and the lady was sharing her menopause experience. I said, girl, let me tell you what you need. Get you some black cohosh for them hot flashes. Okay. She just looked at me. She wasn't even talking to me, but I gave her my 2 cents anyway. And I said, we have another upcoming menopause, but most of us, it should be either June or July. And I would love for you to come and get some information and help you with going through menopause. So that made me feel good that there are more women to reach. That was my biggest. Though my 3 takeaways are pretty much the same: is more people, more women, more communities. Just share the love, share the information. Those are my biggest takeaways.
That's amazing. Good afternoon to you too, Dr. Vertanji. She is watching from the Detroit area. Thank you for being. I do believe she's a top fan on there. Shows me that she is the top fan. So I appreciate you. I appreciate your love. I appreciate your support. So those that did not have an opportunity to see the show and were not in the Detroit area, or were in the Detroit area and was not going to be able to attend, I sent the YouTube link out.
Wonderful.
That was the big thing for me, was sharing the YouTube video and getting the responses back. Oh my goodness. Because I did ask, please, when you watch it, please give me, your feedback on it and what you think. Do we need more? What is this? Of course, giving them the leading question. So, and an open question so that I could get, some good answers back. Overwhelmed.
Wow.
Overwhelmed. And the biggest piece that when people said that they loved about it is when we talked about advocacy. And I was like, really? And they're like, yes, that was my piece. So that was, out of everyone that I sent it to, they said, oh my goodness, I know other people I can send it to. So that was number 2, the big takeaway for me. Number 1 is everyone's receptiveness of receiving the YouTube video. And then the second was their overwhelming response to it. And, them being able to identify with a lot of the issues that were talked about, from our guests, not just from you guys, but those who were tuning in. We had great conversation with those who were tuning in. And they were like, oh my goodness, I was told the same thing. So they were able to identify with those who shared their stories. And then thirdly, it was that they were able to tell me exactly what it was for them. And it was the advocacy piece. Oh, and they wanted to know what I had. So here's my cup. Just my water. It takes 2 to fit, almost 2. There we go. Ta-da. And that was the other thing. What did you really have in that cup? And it was cute, and we knew it had to be purple and a purple straw. Really, Dr. K, really?
Absolutely.
I said, do y'all expect anything less from me? Okay, anything less?
Mhm.
No. So there we go. There you have it. Merry Christmas, friends and neighbors. Merry Christmas in April, because we opening up some good presents here. We talked about many of the women resonated with, number one, their symptoms were making them feel crazy. And then number two, how they were not acknowledged by the
Mhm.
doctor very well. So,
Mhm.
how was that addressed when you met on Sunday?
Wow. So we gave some steps, some practices that we can use when we go to the doctors or to prepare for a doctor's appointment. For instance, journaling your lived experience. No one can contest your lived experience. So you journal your lived experience and prepare for your appointments. Prioritize your questions. If you're not getting the answers to your questions,
Hold on, girl.
or
Wait a minute.
Mhm.
I'm trying to type this out real quick. So, journal your lived experience
Experience, yeah.
to take. Wait a minute. To take with you. With you to the doctor. So we're gonna
Mhm.
say that. All right, this is going to be tip number 1. Journal your
Mhm.
lived experience to take with you to the doctor. All right,
Yeah.
posting, and give it just a second, and I'll put it up. I'll need my. All right, and boom, we're gonna put this up.
One of the things I really took away from the doctor, Dr. Quindra, she shared how she shared about symptom intelligence. And when you're documenting your symptoms, you make sure that you inform your medical practitioner that it's affecting your rest. That your symptoms are affecting your ability to rest properly, and it's affecting your ability to do your job properly. And so that should move your medical practitioners that you need some assistance. It should move if you take it in the workplace. It should move the needle for us to get the treatment that we need.
Okay,
To piggyback on
we
that.
got to take this. Okay, we got to take this slow because we want to put the points up. And so, 1 is journal your lived experience to take with you to the doctor.
Mhm.
And number 2, you said something different from that.
Yes. When you're taking your lived experience to the doctor, make sure that you share how it's impacting your rest, how it's impacting your health,
Okay, hold
and
on.
how the Mhm.
Stop.
Mhm.
We're taking this slow.
Okay.
So the first one is how it's impacting your health, correct?
Yes.
All right. Now, the way you're saying it, is this considered the what was the term that you use? Is it clinical? Okay,
Yes.
symptom intelligence.
Yes.
This is called symptom. All right. So hold on 1 second. I'm going to put myself on mute so I can cough, but we're going to say 2. 2 is describe your lived experience um, Okay, your lived experience. No, wait a minute. Okay, describe your symptoms. SYS. So clinical intelligence is describing how it, so describe your symptoms with clinical intelligence. So the impact of what you're experiencing on your life.
The clinical term is symptom intelligence that the doc was describing last Sunday. So it's symptom intelligence.
Okay,
It's called symptom intelligence.
okay, so all right, so number 2. So how are we going to say that? Number 2 is speak with symptoms intelligence.
Right. Right. So when you're describing your symptoms, you're making sure that the doctor is aware how your symptoms are impacting you, how it's impacting your rest, how it's impacting your ability to work, how it's impacting your performance.
You
Cool,
going
that
too
was too fast.
fast.
Okay, I'm gonna
You
go
going too
slow.
fast. I can't type that fast.
Okay.
Yeah, I got one good hand.
Okay, gotcha.
You're not taking into account my disc, girl, my disc. So
Apologies.
we're
My
going to speak
apologies.
symptoms intelligence. Okay. The impact on, and the VA describes it as our activities of daily living is what it's called.
Mm-hmm.
The impact on our activities of daily living. So we're going to say work, comma, home, sleep patterns,
Mm-hmm.
and I think that should cover it off. We say daily living, our activities of daily living, work, home, sleep patterns. You can even talk about our weight, our diet, our emotions, overall well-being. There we go. That's a good one. I just had to do that last week. Or actually, let's see. High current one, then show this one. Yes, there we go. All right, number 3.
Know your rights. Know your rights. Know that you are a part of the decision-making process. So I don't know if those are separate, but know your rights. Know your rights to participate in your decisions, to access your medical records, and to ask for information. I'm sorry. I just wanted to share it all first, and then I'll come back and slowly. No? Okay, we won't do it that way. Okay.
There we go. You are a part of the decision process.
Absolutely.
Oh. Y'all see I put that in caps. You are a part of the decision process. So what was the next thing?
Be bold, be confident. Be assertive.
Okay.
And be specific. When you're communicating with your medical practitioners.
I'm going to put on there in caps, write it down.
Yes.
And take it
Write
with
it
you.
down. Absolutely.
That, yeah.
Mm-hmm.
No. What does that mean? Hi. It didn't go up there yet? Oh, okay. Just on that. I'm like, wait a minute. There. Okay. Don't play with me. There you go. Y'all see it's in bold. There we go.
Absolutely. Bring a support person with you. A trusted person. Because sometimes when our medical practitioners are speaking to us, we may not hear everything that was said because of how we're processing the information that we heard. So it's good to have someone who can take notes for you so that you don't miss what was said about your experience, your diagnosis, your treatment. So it's important to have a trusted support person with you. Also, be patient. Be patient. Pleasant. And persistent.
So I'm going to tell everybody the time is now 28 minutes after the hour. It is 4:28. We want to say thank you so much for tuning in on today. And thank you, Dr. Carter. I see that you're on. Thank you so much. We appreciate you. The information is not just relegated to, you going through a menopause, but anything that you're experiencing and you need to go to the doctor. And this is not just for women, it's for men. It's if you're taking your child to the doctor. These are good tips and practices that you can use. So if you're just tuning into Rolling on the Road, it is Wednesday. Can you believe it, guys? It's the 8th of April, and it's my grandson's birthday. He is 14 today. Hey, Caius, happy birthday, buddy. Happy birthday from Nana. Happy birthday to you. And we're talking about menopause and mimosas. And yes, I have my water here. and you can have whatever you want to drink. I'm just drinking some ice water. I already showed everybody there's my Fiji bottle that I've been filling my little water up with. So I'm on the up and up. And I can hear y'all already. This don't work. That's not true. That's not what's happened to me. It does work, and it is true because this is exactly how I've been able to get all the things that I've gotten. That's why I'm sitting right now in this $45,000 wheelchair.
Yes. Praise God.
Look,
Praise
I'm
God.
tooting my own horn. Yeah, that's why I'm saying tooting my own horn. Yes, because I've done these, and I didn't even know her to know to do these things. But I tell you, God will give it to you, and he really will, or he'll put people in your life, and this really does work. This last year, I have included, more people when I go to the doctor because the diagnoses have been, more severe, and some of the decisions that they wanted to make. It's like, no, I need somebody else to hear this and not just me. Because one of the things I can tell you that has been very helpful is that being number one, a veteran, that they all know I have the show Rolling on the Road. So I tell them, any shenanigans, I'm gonna talk about you.
Yes.
Do you want to be an involuntary guest on the show? Because that's what you'll end up being, is an involuntary guest, because we're gonna have a conversation about you. And everybody just
Mhm.
kind of laughs. But I love the fact that they do tune in. And so when we have conversations and I have to come in, they make sure that they give me information that I can come back and share on the show. So it
Mhm.
it has just been a beautiful, beautiful journey, even prior to being on the show, that I've had community positions within the VA and within the state of Michigan. So as I have been getting the things that I've needed since I've had my stroke, and the heart attack and cancer and the 5 head surgeries, they have really just gone step by step, because they're like, what, we know that you're an advocate and that you're going to share and help other folks, especially our veterans. So I'm telling you, if you come to your doctor's appointment that way, they will be more than happy to really share the information. And it's different when you come in more informed. And I will say this, and I don't know if you've had this experience, but I've had the opportunity to hear it from the provider's side, and my mouth has been on the floor. I will say that, with some of the things that they have to experience as a provider to all of y'all. Not to me. Oh, no, no. y'all peoples.
Right,
Oh,
right.
maybe me somewhere, before. But have you heard or had the opportunity, even, during your time last Sunday, of what some of your providers have experienced from the folks when they come in as patients?
Well, last Sunday, our provider that was there, they just pretty much want our people, our participants, to be prepared when they come in. That in order for them to receive the treatment that they want, that they communicate what they need. You have to
Okay,
communicate
hold on.
what.
Wait a minute. Hold on. So we're going to say that was our first 6 points were from a patient. And this
Mhm,
is, okay, from the provider perspective.
mhm,
Perspective. Be prepared.
mhm,
Prepared. Did I say that right? No. There we go. Be prepared. Communicate.
Yes, effectively communicate. Yes, your interests, your needs, your symptoms.
Girl, I'm still trying to spell effective. I'm still trying to spell effective.
Effective. Okay.
All right. Effectively express your needs.
Yes.
Your symptoms. Needs, symptoms. What else?
Know the medicines that you're taking. Bring it with you. And if you don't,
know the message you're taking. You know, I would even add on to that one is know how they affect you.
Absolutely. Absolutely.
I'm gonna put on here document. What is this going on? Oh, this foolishness. Okay, go on out the way. Know the message you're taking. Document your side effects. Okay, next.
Ask questions.
All righty. So this is coming from the provider. I know my provider always says, do you have any? She always asks me, do you have any questions? And then I do like this. And I'm okay. We grown here. I'm gonna tell you, my provider, she knows me real well. And I take the time. You see this phone right here? And my little stylist. See, I don't have no stylist to do on here. If I have my stylist, girl, I'll be gone. You can say whatever you need to, because I can jam with stylist.
Right.
Okay. They ain't got no stylist for the look. They don't have that. Anyway, so I have this cute little program on here, and it's called Pick Collage. So I got my little Pick Collage. I go in there, I put down everything that I'm going to the doctor to talk to them about. And then I have, this is what I'm talking about. This is the medication changes that I might want, or how the medication is affecting me. Then I have some suggestions on what I think I should have, and why what you say I don't agree with that. And I print it out. And I have the date and the time of my appointment. And when I come in there, they give me my little book bag, and she see me open up that book bag, and she do like this. She said, "Oh shit, here we go. What do you have, Dr. Kim? What are we doing?" She does like this. She just sit back and she just cross her arms. She says, "So okay, what we doing today?" Because obviously, you know, yeah, you work for me. Yes, correct. This is correct. So I count it as a staff meeting. I'm like, okay, this is a staff meeting. Here are your notes, so you can read along with me. So I make sure she got a copy. I'm like, here you go. Here's your copy. Here go mine. Let's go down.
Go down the list. Absolutely.
We're gonna go down the list. So you remember that one day, that one time when you told me that we was gonna do this? Okay, that didn't work. I tried it. Okay, I took some medication, and I intentionally did not look at what the side effects were. So I did a double blind study. Right.
Absolutely.
That I did not look at what the side effects were, so that when I took the medication, I have down, this is what you prescribed me. This is when I felt the first side effect, and I documented, the severity of it.
Mm-hmm.
And then I went to my AI and said, okay, do I have to wait 2 days or 10 days, or how long I got to go through this? Because sometimes it'll say, give it a week. Sometimes it'll say, give it a week to start working. And then if you feel side effects, they might not come till 2 weeks later, that kind of thing. Hey, Shayna. There we go. Thank you for tuning in all the way from Bel Air. Whoop, whoop. Yeah. Now, she and I, we didn't have these conversations about medications when they're not working. So we write it down and we say, okay, look, this did not work, or these are the symptoms that I had. And sometimes they may not be a listed symptom yet. So you're actually helping the doctor and the drug company. Because maybe they did not, we don't go and become a part of the, the testing study. We don't be a part of that, which is understandable. So then they won't have how it affects us. So then they have the opportunity to say, I got a Black woman who's 60 years old. These are her following conditions. And this was her reaction to the medication because I told my doctor. So now she sends that in and it becomes a part and say, okay, now they can add that to it and say, hey, you know what? Please check it. It'll go to the doctor first. And so it'll tell the doctor, if you have patients over 60, these are some of the symptoms that they may experience. Oh, there we go.
Absolutely.
Thank you, Shayna. And she said, yep, you got to know your body. So it's important that when you have your medications, you look at, how is it affecting your body? What's happening? Did you have this symptom before? And sometimes it may say, it'll give you pimples. Well, if you're supposed to be treating pimples, well, this is not working.
Right.
This just don't work. But you have to remember that it'll sometimes clean your system out and flush out all the bad stuff, and that'll come to the surface, especially if you're going to get your, your skin cleaned and stuff like that. That all that other stuff, it'll start to come up to the surface. So you got to remember that. But I'm telling you, this right here, this little documentation has helped me, my doctor. It helps me get diagnosed better, get the medications, if any. And then the other piece is that there may be a natural way that we can deal with it. And then you include them too. Hey, if you're dealing with this naturally, then you can say, I don't need this medication because I took some, beetroot, and beetroot just brought my blood pressure straight on down. And it's been stable. So we don't need to take these 5 high blood pressure pills, because I started dropping one at a time. Things like that. That this is how we have to, really do it. But I think that we need to have a intense class like this. And say, hey, look, because we scratching the surface by just giving you the way to come in to advocate. But it's that other piece on the other end before you even get there. And then we got to pay attention to our bodies. What was the impetus for you to start being your own advocate? How did you start? You came up with this list, but how did you start it?
Well, I started journaling because I have autoimmune conditions. I went to a doctor's office and I didn't like the way I was being treated. And so I couldn't bend my wrist at one point dealing with RA and lupus. So I asked, what did they have to treat me for it? And they gave me a cortisol shot. And when I went back, I still couldn't bend my wrist. So when I asked the head doctor, what are my options? He told me, stop being a baby. So, you know, I got the writing. I got the writing. And I started looking for options.
Wait a minute. We got a comment right here. It says, doctor, please listen because we know our bodies. There, wait a minute. Hold on. I'll put it up there. There you go.
Absolutely. So he told me to stop being a baby. So I started journaling. I started writing. I started asking other doctors, what can I do? They told me about all healthcare facilities have a manager that you can file a complaint with if you don't like the treatment that you're receiving. I received second opinions. I started looking for a different doctor because there was a lack of empathy in my treatment because I wasn't being a baby. If his wrist didn't bend, I'm sure he would have wanted something that worked too, you know? So that's where the self-advocacy started for me. So I became involved heavily in what I could do, what organizations could I connect with. I started following different organizations online, the Lupus Foundation, I started following the CDC, just looking at what they said about chronic disease. I started going to different events that talked about my new diagnosis, and I started making changes. Even though change is hard and change is difficult, I started making the changes that were recommended. And I asked my pharmacist. Your pharmacist has a wealth of information. I showed him, I said, my wrist won't bend. He said, well, ask your doctor for this medicine. I asked my doctor for that medicine. 3 days later, I was able to bend my wrist. 3 days. I said, oh, praise God.
Wait a minute. We coming out of.
Yeah.
There we go.
Yeah, praise God.
Yeah, there we go. We coming out of Easter, and what did he say? 3 days later, he rose. So we thank God for the 3 days. Now I have to definitely give a shout out to Dr. Lathan at the VA Medical Center in Wyoming, here in Michigan, because he diagnosed me with fibromyalgia. And when he did, he told me the name of the book that I needed to get. I think it's like Fibromyalgia 101 or everything you need to know about fibromyalgia. He said, read the book and it'll change your life. He said, because you're not crazy, feeling the pain. I appreciated him, but I came into the appointment, prepared. I said, okay, I got my little paper. Do you need yours? He goes, no, you can go over it. We can just hold it like this together. All right. So what are your concerns? And I had everything, how I felt, what was going on with me, when was it worse? I went through the whole 9 yards and I had it all written down. And he looked at it, and they all have their little medical phones or however it works, and they can go like this. And he looked at my record and he says, looks like you have fibromyalgia. I know you didn't want another diagnosis when you came in today because I see that you have a plethora. I said, yes, sir, I do. And he goes, but if you read this book, it is going to be just the best thing, it'll help you get through, and you're not crazy when you're feeling all of this pain. And the VA has an excellent, pain management, team. He said, which I'm a part of. And he says, I'm open to any modality. Is there anything in particular that you want? And I said, well, I do acupuncture and cupping. He says, oh, those are some really great ones, to do. We also offer you the cortisone shots as well, because you have some other issues that are going on that are probably exacerbating, the fibromyalgia. So we can offer you the cortisone shot. And this is the piece that I appreciated about him. He said, just know that getting the cortisone shots will cause your cholesterol levels to go up. So I see that you've had a heart attack. You need to make sure that you check your levels and let your cardiologist know. I just started crying. Oh, I just cried. Because number one, I didn't expect that from a white man.
Right.
Talking to a Black woman who is in a wheelchair. His empathy, his attention to detail, him knowing his craft well enough to know these are the side effects. I'm going to do this to you. These are going to be the side effects. This is what you need to do. This is all who needs to be informed. And I just was like, I did the ugly cry in front of him. I did the ugly cry. And I appreciated him because he went and got the box of tissue and he said, is it okay? And yep. And he patted me right here. He said, it's going to be all right. He said, we know, and we're going to do this together. I was like,
Yeah.
But I will tell you, coming in with a piece of paper makes a world of difference.
It does.
Makes a world of difference. When you could come in, this is what I've been experiencing. This is how long I've had this, and how it's impacting my life. So then it's like, one of the things that I had our VA, what do you call them? She's kind of like the liaison, but the MSW, is that what I want to call her?
Social worker.
Thank you. That piece. So each medical team has a social worker that will work with you if there's something that you need. So I do like the holistic care that, once you see your primary care, then if you have to go over to pharmacy, you're in a booth, and then pharmacy talks to you about the medication that your provider just prescribed to you. They go over everything, and they're like, do you have any questions? After they tell you what you're getting, what it's for, and what you may experience. Then they have a social worker that says, okay, you have a new diagnosis. These are the things that you're going to need to help you with your activities of daily living now that it's changed. Like, say, for instance, you might need a cane now, or you may need to have a walker. So they send you over to the social worker as soon as you finish. You'll go see the social worker first and then go to pharmacy. So you'll see her and she'll tell you, all right, these are the following changes. Here's your paperwork. And this is what happened to you today. And you're seeing me because you need, you need a walker. Oh, okay. So she'll tell you, get your walker. They have a nice system in how they do it. Now, my question is, do they do that with you in the civilian world?
Yes.
Okay.
Yes. Social workers are available, especially if you go through, when you tell your doctor you need to speak with a social worker. And sometimes after you speak with your doctor and they will suggest you speak with a social worker. If you go through emergency, a social worker will come and talk to you, or they will take down the information and they will give you information from the social worker. But with your recipient rights, you do have access to a social worker. Yes.
Okay, so I don't see so it's not the same with the VA. So there's a piece in there where they're making you more responsible for your own health care. Whereas with the VA, you're responsible, but you don't leave there without all of the pieces. So you come there, if there's a change in your health, then they send you to the social worker. Then you go from your primary care to your social worker, and then to pharmacy. You don't leave without everybody, without seeing every piece if something happens to you or you come in for an appointment.
No, that's not how it is in the civilian world. After you share what you're experiencing, if it's necessary to see a social worker, one can be provided. And also has a lot to do with how your health insurance is set up also too. If you want to have services, if you want to see social workers separately or regularly, that's a factor too with your health insurance. But no, it's not right after your primary care, then social worker, then pharmacy. No, it's not set up like that. No.
Okay.
But I found that when you go through
kudos to the VA.
Yes, kudos. When you go through emergency, you have a social worker readily available. Or if you're hospitalized, then you get access to a social worker, I think, faster than you do at your primary care office.
Okay.
Mm-hmm.
Hey, we want to say thank you to Lady Daphne for tuning in on today. We appreciate you for hanging out with us and following along. We appreciate you. We're getting all kinds of hearts. Thank you, guys. Thank you for the love. We appreciate that. Yep. Okay, we can say that the VA has maybe in the past given terrible service, and it's nice to know that we're A+++ now, and we're beating out our civilians. So yeah. Lord knows, been in the system long enough. No, seriously. So I'm 60 this year, and I have been a veteran for, I'm getting ready to do the math, y'all, for 32 years. I have been a veteran for 32 years, y'all. Count them. And trust me, it wasn't always nice like this at all. Mm-hmm. It wasn't. Mm-hmm. So I'm grateful that I didn't hung in there. Just like being married. We've been together 32 years. 32, count them friends and neighbors. 32 years we have been together, and we have been through. I'm just gonna say it. I think the hell word is the word for today. We've been to hell and back. Yeah. Right now, what Auntie Pam say? Oh, I'm walking on sunshine. So if y'all see Auntie Pam, tell her I use her phrase. Yes. Oh, I'm all right, honey. I'm walking on sunshine now. Yes. Yeah. They see her. Oh, there's Dr. Kimberly. Hey, girl. It's just like me. I promise you, when I come into the VA, you would think that I was Norm coming into Cheers. You know, remember when they used to come in? Hey, Norm. Hey, that's me. I come in there. Hey, Dr. Kimberly. Hey, guys. Dr. Kimberly's in the VA today. Hey. Yep. Mm-hmm. It's like that, I'm telling you, but it wasn't always that way. So I want to say thank you to the big he that I've lasted this long. 32 years. Mm-hmm. 32 years. Well, I'm like Carol Burnett. It's like, I'm so glad we had this time together, because the time is now 59 minutes after the hour. It is 4:59. An hour goes by so quickly. So quickly, but we gave so much information. So we know what we need to do. This is not our last conversation. Mm-hmm. Y'all gonna look up in a minute, and I'm gonna be sending everybody who registers. I'm gonna send y'all Your glass. I'm gonna have to go to Dollar
Yes.
Tree. I'm like, hello, because I got this from Dollar Tree. Isn't it cute? I didn't
Yeah.
have it for 3 years now. 4. 1, 2, 3, 4. Oh no, I didn't have this glass for 5 years from Dollar Tree. Don't play with my little Dollar Tree. Mm-mm. Don't be trying to count
Hmm.
till out. This was part of the summer collection of 2021. And I got it, and I was like, yes. Because I got
Hmm.
my little grandbabies. They got different ones. But I got the little purple tiki cup. And I was like, yeah, mm-hmm. And we had our little fun. Since you couldn't go nowhere and be with nobody, I said, well, we gonna all be together. And everybody got a cup. So
Hmm.
me and Doctor, so y'all get it in your mind, Dr. Crystal Kidd. Come on, y'all put your hands together for that. Yes. Dr. Crystal Kidd and I are gonna when we get off of here, we're gonna plan it. 100 Shades of Diversibility gonna sponsor it. So look,
Hmm.
hold on. Myself said, we about to sponsor this. We about to do what? Mm. We finna sponsor this. I guess we are. Okay. I got to divide myself. Y'all understand that Rolling on the Road is powered by 100 Shades. So I'm a host on this end. Then I still got to turn around to 100 Shades and say, well, hello, 100 Shades. Can I? I know that was funny, wasn't it? Mm. Oh, yeah, 100 Shades. We about to sponsor this. We about to do what? Y'all, okay. Mm. So, yeah, we're going to talk after we get off of here, and we're
Hmm.
going to make sure that whether you in person or you're going to be online, we're going to go to Dollar Tree, say, hello, do you have any more of these? And I don't even remember if they came in other colors. All I ever see is purple. I don't see no other colors. I'm just saying. Or maybe we get a generic cup and we create labels or something like that. But we're gonna do this, and we're gonna see how many people across the nation that we can connect. That's gonna be our goal. How can we connect everybody? So maybe we just need to come up with our own and put a little label and stuff on them, have them labeled to be real crew. And we're gonna get t-shirts. We're gonna get t-shirts and child. I know some of y'all gonna say we need a fan. Okay, we get a fan and all of that. So we're gonna start today. And we're gonna put this, and we're gonna take it all over. Because guess what? On this platform, we global. So we're gonna see if some of our friends over in Nigeria, we're gonna get them involved too. Send them a cup.
Hmm.
Because I want to know what they do over there. Didn't think about that one, did you? Uh-huh. Got you. Got you. All right, y'all. On this time next week, I will be, I don't know, I think either Tuesday or Wednesday. I'll be hanging out with the governor. This will be our last Gretchen on the Grand. I have attended all 7 of them, friends and neighbors. This will be the last one. So y'all don't forget to register to vote, because we got some good candidates that are on the ballot to become our new governor. I don't know if they're going to be like Gretchen, but hey, I guess. Still got to vote, though. Still got to vote. So maybe we might sneak in a live from there. Be like, hey, and maybe I'll get her to come on and wave at y'all or something. Be like, hey, Big Gretch. I'm like, what up, though? She might say it. You know her. And
Right.
what she might say. No
Mhm.
telling. So, but I would definitely talk to the powers that be. And I think as long as I don't give out the location of where we are, that I think I might be able to go live. But just know on next week, not sure how we gonna work the show. I might maybe I'll come on early or something like that. I don't know, but we'll figure it out. But definitely, I will be with her on next week. So thank y'all for tuning in. I appreciate y'all. I love y'all, and y'all take care and enjoy the sunshine while it's here, because I hear there's some snow and rain coming.